and good morning, everybody, and welcome to Thomson Reuters. On behalf of Thomson Reuters Foundation, it really is a pleasure to welcome you here. I wasn't sure how many of you would actually make it, would actually dare brave the transport crunch that's already starting to descend on this part of London with the Olympics coming. And in fact, at one point I wasn't even sure I was going to make it this morning because I was stuck on a DLR train between stations, some guy's armpit in my face and somebody else's elbow in my back. And I remember just thinking at the time, a little information would go a long way here, people. It would be really helpful if just an announcement or something, just so I could make a decision about whether to get off the damn thing, whether I would make it to this event, whether I should be looking for alternative ways to get here, and so on. That's a really, really trivial and, in the bigger scheme of things, negligible example of how you can feel really disempowered with a lack of information. Imagine that times a million in the thick and tumble of a real humanitarian emergency. You're trying to make really big decisions as the first responder in a crisis. It's the people affected themselves. You're trying to decide what to do. And good information is incredibly powerful, incredibly empowering. Thomson Reuters Foundation, like many of the other groups involved with CDAC, believes passionately that information is a form of aid, but it's not just about a deliverable of information, which is a key part, but it's also that feedback, that two-way flow of information that helps to inform the aid response as well. We are delighted to be part of CDAC, and I'm particularly happy to be hosting this event because it really starts to get to the nitty-gritty, practical stuff. We're going to be talking about tools that are available for you to use here and now, the next time there's an emergency, to help with communications with affected populations. I would like to introduce you to Anita Shah, Miranda Eeles, and Robert Powell from infoasaid, which is a joint project by BBC Media Action, formerly known as BBC World Service Trust, and the media development organisation Internews. So I will hand over to you now. Thanks.
Okay, thanks, Tim. So infoasaid, as Tim mentioned, is an innovative initiative that's operated by two media development organisations, BBC Media Action and Internews, and it's funded by DFID. We have a £2 million grant. We work both in terms of preparedness and response with the view to integrate communications with crisis-affected communities. In terms of preparedness, we've developed a range of tools and resources. This is our website, www.infoasaid.org. And in addition to the three tools that I mentioned, the message library, the media guides, and the e-learning course, we also have a set of diagnostic tools. And these include questions on information needs and access, questions on audience profiling, questions on determining whether mobile phones or radio are the most appropriate channels, a template for developing a communication strategy, preparedness and response checklists, etc., etc. So the diagnostic tools really serve as assessment tools that help identify the communications preferences of crisis-affected communities. So without further ado, I'll hand over to Robert to speak a little bit about the Media and Telecoms Landscape Guides.
Thanks, Anita. Morning, everybody. The Media and Telecoms Landscape Guides are a complete guide to communications in several fragile states. So in these guides, you'll learn about how people communicate with each other, how far they use mobile phones, and indeed how much mobile phones cost, whether they use SMS very much, whether they go online through their mobile phones, whether there is private radio, if so, who listens to it, the extent to which people might use television rather than radio, and there is a listing of all the main media organizations. There's also a listing of the main telecoms companies and an assessment of which ones cover where and which have the biggest number of subscribers, which is important if you're planning a communications campaign that as many people as possible should be on the same network. The ones that are in red are published guides already. We have actually published Mozambique already, but it hasn't been adjusted on the map. And Chad will be the next country that we'll be publishing coming up at the end of this month. The guides vary in length from about 80 A4 pages to 200, according to the sophistication of the media environment. In Zimbabwe, for example, you have 4 radio stations, all of which are state-owned. and in Indonesia you have over 2,000. You will learn things from these guides that, for instance, Yemenis and Pakistanis are moving away from listening to radio to watching television. This was an issue that came up in the Pakistani floods when the first reaction of many media development organizations and aid agencies was to use radio as a means of communication. Very quickly, if we can go on, I'll show you what an individual guide looks like. It's organized into sections with a general introduction, then there are overviews of media, and then you can drill down into radio, television, print, online media, and we have a section on traditional and informal channels. If you go to Juba, look for Sultan Jambo, the man with the loudspeaker van. He's very good for informing local people about what's happening. He's there. Media resources, if you need to make videos, do audio, you need photographers, you need a printer, you need media development organizations have a presence in the country. They're all listed. And then we have the telecoms overview and the listing of telecoms companies. One of the things we have is, for each country, is a broadcast coverage map. This is Nepal radio. And if you zoom in on that, these red blobs will actually dissolve into, click on this one. Let's see what that one is. That gives you the name of the location, the name of the radio station, and the frequency on which it broadcasts. So if you know pretty much where it is you want to reach, these interactive maps can tell you pretty much what radio is there. We have a little more problem getting television data. We get it for some countries, not for others. That's because in some countries they use a lot of satellite and cable, which is more difficult to map. And in some countries like Colombia and Pakistan, the whereabouts of TV transmitters are state secrets. I just came back from Niger yesterday, so I was actually using the Niger landscape guide to find out what was the name and telephone number of the coordinator of community radio stations in Zander. And I looked him up, and the telephone number was actually correct, and the guy answered immediately. So it's a shortcut. If you have to set something up quickly, you immediately know how to get in, and you can avoid false assumptions. Like if you go into South Sudan, the official language is English, but probably the better lingua franca to use is simple Arabic. When we were there last year, one aid agency was sending blast SMS in English about hand washing. And first of all, people who have mobile phones in South Sudan are not your target audience. They're the sort of wealthier, more educated people anyway. Secondly, even the people who have mobile phones, most of them don't speak English, let alone know how to read and write it. And so it was a case of taking something that you might do in Europe, putting it in the third world, and not really adapting it to the local circumstances, so the impact was much reduced. Updating is very important, and there are a couple of guides on which we have done that already. For instance, after South Sudan got independence, we have split the Sudan and South Sudan guides and updated the South Sudan one. The North Sudan is in the works. Last year, when Côte d'Ivoire went back into civil war, we updated with the chaos, and then we updated again at the after the Ouattara faction won and things had settled down again. So we aim to hand on all our tools to other agencies once our budget and our time span for existence runs out in December. And it is our sincere hope that whoever inherits the media landscape guides will continue updating them on an annual basis.
Okay, so I'm going to give a very whistle-stop tour of the message library. There are nearly 370 messages in it across 7 clusters: WASH, water and sanitation, health, food security, protection, education, camp coordination, camp management, and nutrition. And we're hoping that shelter will also come on board. I've been working with all those 7 clusters at global level, but also using technical experts in the field to draft the initial content. And then through the working groups at the global cluster level, we've also had a lot of feedback. So there are various ways of actually accessing the messages. I'm going to do a quick search on that problem that comes up every time. in every emergency. So you can just do a quick search on, for example, diarrhea, and you can see that 31 messages have come up with that search criteria. I'm going to go into one, just what is diarrhea, and you'll see that it basically covers all the messages that are related to diarrhea. So it starts, what is diarrhea, what is the cause of diarrhea, how do you prevent it, when to contact a health worker, location of nearest health facility. The messages include alerts, raising awareness, self-care, and program sort of prompts. But clearly in every single context that will need to be changed, adapted, translated, pilot tested, and then rolled out. So it's really a reference rather than actual messages that go out. So the advanced search, which is a bit more nuanced, and in a way, what we're hoping through this is to show how so many threats are related to different clusters and sectors. So I'm just going to go to something like gender-based violence. Okay, so every message in the library is color-coded. This is really to enforce the do no harm principle, the fact that it is a generic reference library. It's not supposed to be used, as it stands. In GBV, which falls under protection, there's already a level of sensitivity. So you'll see that this message has got a kind of amber or orange exclamation mark. That's a relatively sensitive message, and it gives you a little bit of guidance around culturally appropriate language, but also, what channel are you going to use to disseminate this message, and think about it. So there's a bit of guidance there. And then on this message, you'll see that it's red. So this is a highly sensitive message. In fact, you can't even see the context, the content of the message until you've read the prompts. Be careful, this could lead to more harm. Make sure you cross-check using the questions below as a guide. Is there a risk of harm by disclosing this information? Is the channel of communication suitable? Have you checked with service providers if it's okay to go public? You then have to click I understand. And then you'll see there is the content of the message. And then there's additional guidance below which says disclosing details of service providers, where to seek assistance may put the survivors, service providers, and communities at further risk. So we did this because UNHCR, that leads the protection cluster, were very, very concerned about how the end users were actually going to use this library. And I think they've certainly completely endorsed the changes, and they really, really like these sort of safeguard mechanisms. So that's just to give you an example of a highly sensitive message. So as I said, you can find a bit more about the library. There's a full kind of comprehensive guide, because really that guide contains the contextualization process. What do you need to think about? Education levels, cultural behaviors, language, whether it's feasible, whether it's actionable, etc., etc.
Ideally, you should contextualize some messages beforehand, knowing the risks and threats that you face and the hazards that you're exposed to, rather than scrambling in an emergency to quickly contextualize, pilot test, and then figure out which channels of communication to use. Okay, so this is infoasaid's e-learning course. We found that lots of our colleagues from various aid agencies were saying, yeah, we get it, we understand the concept, but how do we communicate better with crisis-affected communities? We found that at best, aid agencies were communicating one way, and there was very little dialogue, and there was very little systematic collection, analysis, and response to feedback received. And we felt that there was a clear gap and a need to develop some very practical learning around not just information provision and how to do that, but also facilitating dialogue, and then asking, listening, and acting on the information received.
Okay, so on the website you have the tabs up here. You click on e-learning, and that is basically a brief summary of how the course is divided up, and then you can actually launch the course from the site.
So the course is divided into 5 modules. The first module just provides an overview of how to use the course and the functionality. The second provides an overview of the key concepts, what we mean by communications with crisis-affected communities and why it matters. Then we have 3 modules that are scenario-based challenges. So knowing your target audience is set within the context of an earthquake. developing key messages and adapting them to different channels and different target audiences is set within the context of a post-conflict situation. And then communication, a two-way process, i.e. the explanation, discussion, and feedback, is set within the context of a hurricane and flood.
I'll go to the fifth one.
Yeah, so we'll just show you an example of one of the modules. So how each module is structured is that it's divided into an introduction and then a challenge. And the introduction provides an overview of the country context. So what is the situation in the country? What is the aid agency doing? What is the response? And there's an information needs and access assessment, which should give you information on A, which channels of communication communities prefer, B, which ones they trust, and C, which ones are still functioning post-disaster. We then move on to the challenge.
Good morning and welcome to Esidara Today here on Liberta FM. Our top story this morning is, of course, the devastation caused by Hurricane Carina and the subsequent floods. These communities have been hard hit before, haven't they?
Yes. It's the third time in 5 years this area has been hit by a devastating hurricane.
Anita, thanks for the update. Stay safe out there. We'll come back to you later on in the program for more on the relief operation.
Each question in the challenge begins with a prompt, and the prompt can be take the form of a radio report, as you've just heard, or a voice message, or an email. Based on the prompt, there's a question, and you have an MCQ, essentially, a set of multiple choice options to choose from. You have 2 goes. On the first go, if you get it wrong, the icons on the right-hand side will flash, and you can go to them for more information, be it background or guidance or a viewpoint from a member of the community or one of the staff members involved in the operation. And you'll also get feedback on your choice. And then when you click the second time, hopefully you'll get it right based on all the assistance that you've got from the icons on the on the right. And you'll also get feedback if you get it wrong. So that's an example of a viewpoint. And we have viewpoints, we have background, guidance, and case studies for each question. And so that's the e-learning. Again, essentially a preparedness tool. And there's also a resources section where you can download checklists, publications, and more in-depth case studies, because the ones that are in the tool are quite short. Through the responses, the pilot projects that we're doing with aid agencies, we're also trying to glean a lot of learning. And our end of project event, which will take place in December, will focus mainly on the learning from the responses. And we have a research and learning section where we're now doing learning reviews from the pilots that we've done. And the idea is to have a baseline study, which we do before we start the project, and then a learning review post-response. So hopefully this should contribute towards the evidence base and really demonstrate that communications with crisis-affected communities makes a difference. Every time we do a learning review and our researchers come back and say that it has made a difference, it's actually working. We are getting a sense that the tools, the media landscape guides, are being used quite widely by donors, by aid agencies, by other media development organizations, and by the private sector. But we need to do, I think next year, we'll need to do a more systematic user perception survey. On the message library, it has not been rolled out in the field yet. And what we didn't mention was that we're handing the message library essentially over to OCHA to host.
I mean, the limitations of the message library is that it's generic. It cannot be used in an emergency. It's a reference. And so what we're hoping through our conversations and discussions with OCHA, when we do the transition, the idea is that in each emergency they will have an emergency-specific platform, and that will be echoed with the message library, and contextualized, localized, translated messages will be available for each emergency on this platform. So that's when the real use will come out. And in fact, whenever I do present the library, they say, this is great, but where are the translated, tested messages from Haiti in Creole, for example? So it's an ongoing process, but I need the materials to be sent to me.
I wanted to give you a scenario where you could actually look at 2 of our tools and use them to figure out how to respond. And looking in particular at the message library in combination with the media landscape guide. And we've chosen a scenario which is a real scenario right now, which is that there are more than 50,000 refugees from Mali in southwestern Niger. They've flooded across the border. They're in makeshift camps. There's been an outbreak of cholera. There have been deaths. We're even allowed to call it cholera, not acute watery diarrhea, because government's okay with that. There's some information about the people who are there. So they're mostly Tuaregs. About a third of them have got mobile phones, but they've only got SIM cards, obviously, for the Malian network. About half of them have got access to an FM radio set. There's a security problem in the area. So actually sending people into the camps regularly is very difficult. So how do we get information to these people? And how do we get information from these people if we can't actually go there as much as we would like? That's really the challenge.
There is a very useful map here of what radio networks are available and how far their reach goes. We have got issues of language because there may be tribal languages which are the same across the border. It may be completely different. So how do you get an appropriately translated message going out on the radio? The infoasaid site is quite interesting. There's a lot on treatment of cholera, not very much on prevention. So what messages are going out if you're adapting these messages? But it is a new tool, so I think it's a very helpful starting place. Issues of how frequently you would need to get this information out. Is it an hourly bulletin, 15-minute warnings? What do you do to avoid panic? You've got social issues, or is there shame associated with having cholera? Can you talk about going to the bathroom, that type of issue? But it's anything to add from the group?
Yeah, we were just talking about sort of how we can manage two-way communication, and our thoughts were that we could use a radio station to talk to communities and then provide local SIM cards in order to be able to have the communication working the other way.
There's one radio station with national coverage, but they're transmitting in French, which is the official language, but also we found that Hausa is a much spoken language, and there are radio stations that were transmitting there as well, I think up in Tillaberi. So we're primarily going to use FM radio stations and negotiate with them to transmit messages in order to reach as many people as possible. And our skim of the coverage indicated that that could be effective. We didn't think mobile phones would be effective or mass SMS because most of the phones are Malian and they're too far from the border to have confidence there would be good coverage. But we thought also about trying to distribute local SIMs if we negotiated with the main providers.
We're basically looking at, obviously, cholera messaging being the most important. Given that it's a confined camp and there's sort of security problems and restrictions, we were thinking a lot of the messages will have to be contextualised to how people can actually help themselves and deal with the situation on their own. Things like sort of making their own ORS for rehydration, trying to isolate people who are infected, and all the prevention ways of stopping the transmission of cholera. So they'd be the key.
So
steps.
we decided with a little bit of help that we would set up a tent, some kind of local, actually, an on-the-ground location for people to come to. And from that tent, we would disseminate access to mobile banking, and we would also distribute SIM cards, and we would promote a radio program that people could, give them the address for the radio station, and then we would, that way people would all be connected to communicating and get information.
Give them help for phone-ins as well.
Yes, and arrange for a phone-in program.
One thing that I think we added is that to have the two together so that people can send text messages with questions, and then the radio will broadcast the answers. So yeah. That's
okay. A couple of groups have talked about SMS messages, but before you use SMS, you've got to be sure that people can actually read and write, and in which language they are literate, if they are.
Yeah.
Thank you very much. Just to briefly sum up, very pleased that all of you have come up with interactive communication solutions, not just telling them what to do, but getting feedback. The purpose of the exercise is not so much to see whether you've actually got the right answers, but to show you how the tools that we've developed, very briefly, can help you in your decision making. I realize that this has been terribly short and you should have a whole day to do it, but thank you very much indeed, and I hope you've enjoyed it.